Assalamu alaikum. We will continue with our session. So we reach up to the small intestine function. And here again, this is the small villi inside the intestine, inside the small intestine. And we said that it is for mostly, it is increasing the size, the surface area of the small intestine from inside, and also it is for absorption, as we said. So it contains also the bare patches. The bare patches, which is there, we said in the last session that the bare patches, it is from the lymphatic system, and it is for the process of filtering, and it is like a gate which prevents the harmful thing to go inside the blood or to go directly to the blood. So the large intestine, it is called large intestine because it is larger in diameter. The small intestine, the diameter of the small intestine, it is smaller than the large intestine. So the large intestine, the large in diameter than the small intestine. But it is also shorter. The length of the large intestine, it is about 1.5 meters. There we said that it is around 6 meters. So it forms the small, it is framed the small intestine, as we said. So it is from that, it is connected from this side with the small intestine, and it is extend from the ileocecal valve to the anus. So this is, we call it the ileocecal valve. Ileocecal valve, which is the junction between the small intestine and the large intestine. It is an important point that you have to understand and to know. The ileocecal junction, ileocecal valve. So it is start from ileocecal valve, which separate the small intestine from the large intestine up to the anus. This is the ileocecal valve again, and this is the cecum. This part we call it the cecum, and this is the appendix, which is small protrusion at the cecal area. It is the appendix. Up till now, they don't know exactly what's its function about the appendix. This is, we call it the ascending colon. So it is mainly from cecum, ascending colon, then transferred colon, and this is the descending colon. Then sigmoid colon and the rectum. So start from ileocecal valve, junction between small intestine and large intestine. This is the cecum. Ileocecal valve, this is part. This is the ascending colon, the transfer colon, descending colon, then sigmoid colon, and the rectum, which is the open to the outside. Then anus sphincter. So we said that in the small intestine, internally there are villi. In the large intestine, there is no villi. The function of the villi, it is for mostly for absorption. Here, absorption is there, but the absorption for what mostly? So it is mostly for water. So goblet cells in it, it is mucosa, which is also produce mucus, and it will lead to lubrication of the intestine. So goblet cells are there, but there is no villi. Longitudinal band of muscle cause buckets like sac, which called the hastra. Those small, it is divided. If you see that, it is like if it is divided to small buckets. So each one it is called hastra from the junction. So those parts, it is similar to small balls connected to each other. So those parts, it is called hastra. The function, eliminate the food residual. So the food residual, which is as the end product of the digested food after the absorption happened inside the small intestine and absorption of water inside the large intestine, it will be eliminated by the large intestine. Water absorption, so it will absorb water, so it will dry out the food residual, it will make it formed, otherwise if the fluid is more, it means that you will have diarrhea always. So it will absorb water and it will form the stool, so the residual, it will be eliminated. No part there is no part in digestion, so it doesn't play any role in digestion. Digestion, it is happened from mouth, stomach, and duodenum mostly. So, but in large intestine, there is no digestion. The esophagus, it is just a pathway. It is a connection. There is nothing happening. No chemical digestion, no absorption, nothing. Just it is a pathway from the mouth to the stomach. Here, it is a passage to outside for the excretion. Absorption of water is there. No digestion at all in the large intestine. The mucosa, which is produced there, it is for lubrication, keeping the stool moist and easier to defecate. About the accessory digestive system, in the accessory digestive system we have mainly 4 things. The 2 teeth, the salivary gland, both are there in the mouth, and the liver and gallbladder and the spleen. So those are considered as accessory digestive system that link or help in the process of digestion. About the salivary gland, there are 3 pairs of glands. The parotid gland here, غدة النكافية, parotid gland, and sometimes you get infection. And this is the sublingual gland, and it is duct under the sublingual, and the submandibular under the mandibles. submandibular, and it is duct. So there are the the parotid gland, which is coming here in this area, then the sublingual under the tongue, then the mandibular. Pairs are there, 2, 2, 2. So 6 gland is there. They empty their secretion in the mouth. What is the parotid gland are the largest one. So this is the largest one, which is coming here, this side. Lie anterior to the ear. Mumps is an inflammation of the parotid gland. So this is the from the common infection that affect the parotid gland, which is mumps. Nukaf. The saliva, which is the secretion of the salivary gland, it is a mixture of mucus and serous fluid. So it is mixture of mucus and serous fluid. Because of that, it is not thick. The mucus usually it is sticky and thick. So, but the saliva, it is a mixture between mucus and serous fluid. Because of that, it is watery usually. You feel it as water. Is produced by the salivary gland. The 3 pairs of salivary gland are producing the saliva, which is a mix of serous fluid and mucus fluid. The mucus, it will moisten the food, so it will moisten the food when we are taking our food. And also the serous contain enzyme, salivary amylase, that will digest, as we said before, the starch, carbohydrate. Especially when we are chewing the food properly. So chewing, it is advisable always when we eat is to chew the food properly. By that you will feel the taste. By that also you will feel when your stomach will become full. Not as if you are just not chewing well. So when we are not chewing well, we will eat more, by the way. More than our requirement. It contains lysosome enzyme, which is as antibodies, which is IgA antibodies. So it contains antibody, it contains enzyme for digestion, it contains mucus for smoothing and of the food and making the food more smooth. The structure of, then we have the tooth or the teeth. The structure of the teeth, here the thing that we are seeing, we will see that is out, that white part of the teeth, out of the gum, it is called the crown. So this is the crown of the teeth. And here the neck, which is coming under or covered by the gum. See here, this is the bone of the jaw here. This part, it is the bone. And here, this is the root of the tooth. Here is the gum that connect the teeth with the bone here. And this is the root of the teeth. This is the elements of the crown, which is the strongest part of the teeth, the hardest part. This is the dentine, we call it. This is the dentine underneath it, which form a bulk of the tooth, most of the tooth, it is from dentine. And this is the bulb cavity. The bulb cavity, what did you see inside here? Blood vessels are there, and what is the yellowish one here? The nerve. So blood vessels, this is the arteries, and this is the venous blood vessels, capillaries, and this is the nerve. They are coming inside the root. When infection is there, you will go to the dentist sometime to did a treatment of the root and remove the nerve. Connective tissues, blood vessels and nerve are there in the bulb, which is passing through the root. So in the bulb cavity. This is, we call it the root canal. Root canal. That the nerve, the blood vessels are coming through it. Root canal. So the root of blood vessels and nerve are coming from inside. From down, we call it the root canal. From up, we call it the bulb cavity. Blood vessels, nerve in the bulb, which supply the tooth with nutrient and sensation. So we feel it through the nerve, which is there, and the nutrient which is coming to the tooth, it is coming through those blood vessels. This is the gum, or what we call it the gingiva, from here and there, from inside and outside. This is, we call it the peridental membrane. Peridental membrane that attach the root of the teeth to the bone of the jaw. We call it the peridental membrane. So the peridental membrane, it attach the root of the teeth with the bone of the jaw. To hold the tooth in place. This is part, we call it the cementum. Which is attached also the tooth to the peridental membrane. It is called the cementum. The type of tooth, we have three, the teeth, tear and the food. This is the function of the teeth, breaking it down in a smaller garments, so it will break down the food. This is the function of it. Teeth are classified according to shape and function. So according to shape and function, they are classified. In the frontal tooth, we call it the incisor. Those tooth, we call it the incisor, because they are cutting the food. Usually when you want to cut anything, you will put it in front. This is the canine teeth, which is coming after the cutting or the incisor. Then we have the premolar, which is grinding of food. Then we have the molar, which is grinding also of the food. So grinding, it has happened in the premolar and molar. اللي هي الطواحن. So then the incisor and canine teeth, and then premolar and molar for grinding, and this is for tearing اللي هي الأنياب. How many, the total number for adult, how many teeth are there? 32. Yes. The milk teeth totally. Milk teeth.
30.
بس اثنين اللي راح. ها؟ 20. That milk teeth, it will be changed after. So it will fall down and another teeth will come out. So there are 20. But the permanent teeth, they are totally 32. 32 permanent teeth. The incisor, they are 4 up and 4 down. The canine teeth, there are 2, 1 in each side, so 4 are there. 2 down and 2 up. Then the rest are the premolar and molar. So this is the deciduous teeth or milk teeth. So how many are there? As we said, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 10 up and 10 down, so 20. So this is, we call it the deciduous teeth or the milk teeth. The incisor, those are the incisor. Say they will start from the 6th month, and later after 6 months, they will start to erupt from the gum. Later, 8 to 10 months, then those teeth will start to erupt. But mostly, you will see that 2 teeth are either up and down will come for the small infant at the age of 6. Some of them, they might start to erupt their teeth earlier, little earlier. Some of them, they might erupt after 8 months. The canine teeth or the eye tooth, it is at 16 to 20 months, it will be erupt. 16 ل 20 أسبوع. Then the molar, the first molar 10 to 15 months will start. The second molar about 2 years. So at the age of 2 years. Because of that, we can tell the age of the child from the number of teeth. Expectation of estimated age through the teeth itself. This is the permanent teeth. The incisor, they will generate from 6 to 7 years. So at grade 1, usually you will find the children with some missing teeth because it will fall in order to have the new one. And those two about the 8th year. Then the canine or the eye teeth at the age of 11. Thus the premolar and the first premolar at the age of 11. The second premolar at the age of 12 or 13. then the first molar will start at the age of 6 years to 7 years. The second molar, 12 to 13 years. The third molar or wisdom teeth, سن العقل, wisdom teeth, it is from 17 to 25 years. So it is the latest one that will come, that will erupt. And it will take longer time sometime to erupt. The pancreas. So here the pancreas, and here, what is this? This is the duodenum, yes. And this canal is coming from the gallbladder. And here the canal of the pancreatic duct, and this is the ampulla of it. So it is triangular gland with a head and tail. So this is the head of the pancreas, and this is the tail of the pancreas. Extend across the abdomen from the spleen to the duodenum. So the spleen is coming in this area. So it is from the spleen to the duodenum. Lies posteriorly to peritoneum. So it is retroperitoneal. So it lies retroperitoneal. It will produce the digesting enzyme for all food in an alkaline fluid. So all the digestive enzymes are produced for all type of food, for carbohydrate, for fat, for protein. All enzymes are coming from the pancreas to digest the food. So produce also the two hormones, the insulin and glucagon. Both hormones, they are working against each other. So by that, they are regulating the level of blood sugar in the blood. So they are regulating the level of blood sugar in the blood. So the insulin, it will help in that sugar will go inside the cells for metabolism. So this is, again, this is the site of the pancreas, so it is retroperitoneal. So it is not covered by the peritoneum. This is, again, the map. Yeah. Use the Google Drive to go through it. Yeah. So this is the pancreas. What is this? This is the stomach. Here, this is large intestine, small intestine. The liver. As we said before, the location of the liver, it is located in the right side in the upper part of the abdominal cavity. So it is located in the right side under the diaphragm and in front of the stomach. Again, if you want anything, you can ask. Just raise your hand and ask. This is the last time warning. So, it is directly under the diaphragm. It is suspended from the diaphragm and attached to the abdominal wall by which we call the flexiform ligament. This is a ligament. That's to say a band of the mesentery of the peritoneum. It is a part of the mesentery. So this is hold the liver in its position. It has divided to 4 loops. So the liver is divided to 4 loops. Largest gland, it is the largest gland in the body. It has the metabolic regulation and digestive function. So it works as a for metabolism and also for digestion. We will come to the function of that. The digestion, it is producing the bile salts that it will help in digestion, and the metabolism, we will come to it. So the liver and gallbladder here, this is the gallbladder which is coming under the liver, and the secretion from the liver, it will go to the gallbladder and store there. So the liver will produce bile, and bile will leave the liver through the common hepatic duct. This is the common hepatic duct that the bile will leave it through it, the right and left common hepatic duct. So bile is a yellowish to a green watery solution. The color of it is dark green mostly. Bile content, it contains bile salt, bile pigment, which is bilirubin, cholesterol is there, phospholipid, and electrolyte. So this is the composition of the bile which is excreted by the liver. It consists of bile salt, bile pigment, which is mostly bilirubin, cholesterol, and phospholipids, and electrolytes. The bile salt and phospholipid emulsify the fat. So the function of them is to emulsify the fat, changing the fat to be as emulsion, which is soluble, more soluble. So it will change it to soluble by emulsifying them. So produce bile, and bile leave the liver through the common hepatic duct, as we said. This is the common hepatic duct. What's happened to it? So this is the gallbladder again. Those right and left hepatic duct are coming from they are inside the liver. This is the common hepatic duct, and this is toward the duodenum. This is ampulla. This is the cystic duct, we call it, the cystic duct, which is the duct which is connect the gallbladder to the common bile hepatic duct. So the gallbladder is a small, thin, walled green sac. It stores the bile and concentrate the bile by removal of water from the bile. So it is for the storage of bile, and also concentration. The bile will be concentrated inside the gallbladder. When fatty food enter the duodenum, it it will lead to contraction of the gallbladder, so it will squeeze some of the secretion inside the duodenum in order to emulsify those fat. So when fat food enter the duodenum, it contract the and spot the bile outside. So the bile will coming inside the duodenum. If the bile is stored for too longer or too much water is removed, in this case, it might lead to gallbladder formation of gallbladder stone. So one of the conditions that might affect the gallbladder and the gallbladder duct is the formation of stone. Formation of stone, it might be due to staying that the content is staying for too longer time, or it is dried. The water is absorbed more from the content. Because of that, it will be changed to a stone that either it might lead to blockage of the canal, or it might lead to inflammation of the gallbladder. This is the gallbladder stone. So it can be in the gallbladder itself, it can be in the common bile duct, it can be in also pancreatic and the joint between the pancreatic and the common bile duct. So it can be anywhere in the part of the digestive of the canal. So this is regarding the function of regarding the structure of the gallbladder and regarding the structure of the digestive system. For next session, we will go deeply on the function of the digestive system. Any question? Is there any question?